guys. Good afternoon, good evening, beautiful people. Welcome back to our channel. How is everyone doing? Hey, Obodo fam. Welcome, welcome, welcome. I hope we are well today. I throw away salutes. How are we? How are we? I've missed you guys. I've grown so accustomed to these live streams that when I do record videos now, it doesn't feel the same. I don't get the same vibes that I get when we have these live chats. They are the best. They give me life. Do you feel the same way? Yeah? Welcome. Give us a thumbs up. Give us a thumbs up as you're coming in. Thank you so much. Are people enjoying Gistmas? Welcome back to Gistmas. Today is day 6. I feel like people have not been engaging with Gistmas as much because we've not had a live stream since last week. Emma Binu. It's not deliberate. I've been busy. We had our Christmas party on Saturday and Sunday I was wasted. Like I wasn't me. I didn't move an inch from my bed on Sunday. The only time I stood up was to go to the bathroom or to go to the kitchen to get something to eat, to drink, not to cook. Oh, I was totally knackered because our Christmas party was awesome. It was beautiful. Thank you so much, Chill Power, for asking. I'm going to post the video in a few days. I will post it because the thing about recording the videos again is that you have to edit it. This is the wahala, you see. Anybody that thinks that YouTube is easy, I dare you to try. You will see how easy it is. When you do the live stream, it's not easy. Hello, baby. You okay? Welcome. When you do the short videos, you have to edit them. Oh my God. Yeah, but we're here for it. We're here for it. Thank you so much, everyone, for being here. I have a guest in the house. Let me not go yapping, yapping. You can see I missed you guys. I did miss you. There is this kind of energy that I get from these live shows, man. Just interacting with you guys gives me life. Honestly, I do enjoy them. So I've missed it. This evening, you can see me getting ready. I was like, I've not done live shows in Live with Peace. I've missed my Bodo fam. Let me get ready. And because I know that my guest was going to put her camera on, I decided to, pick myself up and brush up a little bit to sit down here so we can talk. I miss you guys. Yeah. Do you know what? I promise you. Tomorrow, anyway, I'll give you the information later. We're going to be doing live stream back to back to back now. Yes. Don't worry. Because how can I be missing my Budu fam like this? It's not nice. Welcome, everybody. So tonight, I'm here with Dr. Adesola. You guys remember? How many people remember Dr. Adesola? She was here a while ago when we were talking about, is it what's the name? I can't never pronounce that name. Geriatric. Is it geriatric? Yeah? You're muted, my darling. Unmute yourself. The beautiful, sassy, assertive Adesola was here with us and told us about elderly care in Nigeria. And we haven't seen her since then, but we keep in touch once in a while. She came back again thereafter. I think you did to
Yes,
talk to us about what was it that you talked to us about?
mental health.
Mental health. Yes, I remember. Because I know that a lot of people did follow up with the counselor that you referred to us. So we are so pleased to have you back again tonight. Thank you so much. Ade, welcome.
Yeah, thank
You
you.
look so pretty.
Oh, thank you.
How's it going? How's the family? How's work? You were training to become a GP.
Yes.
Are you still on the route?
Yeah, I'll be through March next year.
Wow. Well done. Well done. From psychiatry to GP. Wow. Wow.
Yes.
Why did you switch?
Well, maybe I would add that's what I will talk about today. It was
All
due to
right. Okay.
family and life happening.
All right. I understand. Welcome. Welcome. Guys, if you're happy to see, Dr. Adesola's pretty face, give us a thumbs up. Yeah. So she reached out to me and said, she's been keeping up and she said, Sis B, you are doing well, but obviously I'm not a medical person, so my knowledge about these things that affect us as Black people is limited. And she volunteered herself to come here to educate us today. And I did say it in my previous shows that this kind of videos are not, they don't interest our people. They're not interested in this. But you know what? These are the most important one, gun, that will keep you and I alive for a longer period because information is power. So anyway, thank you so much. Thank you
Yeah.
for being here.
Yeah, thank you, Sis B. Thank you for the wonderful work you're doing. I watch your show, and I I keep up with everything, even though I really don't join all the lives, but I watch the replays, and I like the dedication, the tenacity. I see your passion towards empowering, towards helping the people within our community, and anything I can do to support you, I'm more than happy to. So the reason why I volunteered was because I watched the last episode where you talked about the death of the response to someone's death, and I saw the responses, the feedback, how people were talking about health checks and well, every other thing. And I volunteered that I would add, because in my practice as a GP, I've seen a lot of our folks, and I see the difference in the health behavior between the West and the and we.
Yeah,
Yeah.
of course.
Yes.
So for clarity purposes, those of you live in the Americas, GP means general practitioner in the UK. So those are
Mm,
people that have like the surgeries where their primary health care, that's the first place you go to. You don't just go to hospitals here except it's an emergency. So
mm,
the system, the way it's designed is that the GP is the general practitioner is the first point of your visit when you have any health problem. So that's where Adesola comes in. She's a GP now, almost qualified. She was in psychiatry before,
yes, I was.
yeah, now she switched to another side of medicine. So thank you so much and welcome. What do you have to tell us? You said that you want to go through something like red flags in the system, in the anatomy, that things that we, as people of color, need to be aware of so that at least we can live long like our counterparts in this part of the world.
Yes, exactly. So I would dive right into it. But before I go in, I want to emphasize something, that you are what you know at every point in time. Regardless of the drive, the determination, what you hear, at every point in time, you are what you know. And life is beautiful when we constantly learn. I know everything I'm going to say today, I can be sure a lot of us are not aware of it. It's called the red flag signs. I would implore you to take your pen, pencil, your notebook, try and write this down, because I'm going to go from head to toe. I will try and cover the systems, the ones that usually causes this sudden pattern of death. Can I use that word here?
You
Sorry.
can use passing. Yeah, you can use
Oh,
passing.
passing.
Yeah, or delete
Passing.
or
Or
deleting.
delete.
Yeah, because of this platform,
All right.
unfortunately.
Okay.
Mm.
Yeah.
I have my paper and pen. I'm ready.
All right. So we've talked about health screening, and what usually comes to mind is check your blood pressure, check your sugars, your cholesterol, but there's just so much to it. So I'm going to break it down and talk about the screening, talk about, if you want to go about it privately, I would tell you the things to request for, and I will also tell you the ones that you're entitled to, that you can request from your family physician wherever you are. So before we go into the screening, I want to talk about those ones to scream about. So I will talk about what to screen for and what to scream about, because regardless of how you screen, you're only checking your body at a particular time. So you can't be rest assured that because I have screened last year, then I am fit to continue movement. You're not like a car. It's not like an MOT. Of course, we compare the body to being a car, but the car can
Mm-hmm.
break down a day after your MOT.
Mm-hmm.
You should be able to understand those warning signs to scream about. Now, I'm going to start from the head. Now, for the head, which a lot of us complain about headaches, and because we're used to these symptoms, everyone has experienced headaches at any point in time. We tend to minimize it. Let's just take it
Mm-hmm. Mm-hmm.
paracetamol, just paracetamol and move on. Now, If you've got any headache that is waking you up from sleep, that is not that's not normal. It has
Right.
to be explored. If you got any headache that is associated with nausea or vomiting, especially in the morning, you wake up vomiting and you've got headache, it shows there's something going on in the brain. Another thing about headache, if you've got painful scalp, like you're combing your hair and the scalp is tender, that is a serious sign of something called temporal arteritis. Now, usually when there's headache and the scalp, you can't comb your hair, just check your blood pressure.
Mm-hmm.
If that happens, you need immediate. Like this is not something you don't go to the GP. Go straight to A&E and tell
Mm-hmm.
them these three signs because it can lead to irreversible eyesight loss. So
Right.
yeah. Then the fourth one, if there's an headache with sudden neck stiffness, you can't move
Mm-hmm.
the neck to the left and right. That
Yeah.
is a huge red flag sign. At times it comes with rash, and then we talk about meningitis. But there's this triad of headache, neck stiffness, and rash. So for the head, that covers headache. Any other headache aside this could be stress, could be due to anxiety. But just watch out for these red flag signs. And when you go to your doctor and they're asking for this, please don't minimize it. Don't
Mm-hmm.
what is coming? I don't need to.
Yeah.
I'm fine.
Because we tend to minimize headaches, especially, right? We
Yeah,
think, oh, it's just headache. Maybe because I didn't sleep well. Maybe because it's stress. I'll take paracetamol. I'll take Panadol.
yes,
I'll take Cocodamol. I will be all right.
yes,
So you are saying that headache can be something that is even critical.
yes. But these are the red flags. These are the things that we ask people. And I
Right.
understand that when someone says I'm fine, you're trying not to be a moaner. So I understand this. I'm okay. I'm okay. When you say I'm okay here, literally, I just document you're okay. So please, when they're asking all this, it might sound unusual, but take it to heart, reflect and answer and be true about it. Now, the last one regarding headache is if you can't withstand bright light, if you have to go into a dark room, then there's something wrong. You have to check yourself immediately. Um, there's something we always tell people, we call it fast sign, FAST. When there is a facial droop, so I will try to imitate it. Some people will be talking to you, and before you know it, they start talking like that.
Hmm.
The thing is, you wouldn't know. It's someone seeing you that will see that the mouth is moving
It's
to the side.
dropping. Yeah.
Yeah. So it goes like this. It shows that this side of the head is beginning to have some issues. That's the F, facial droop. The speech slurring. They start talking and I'm trying to demonstrate because that's how I talk to my patient. They start having this speech slur. But the thing is, at times you can compensate and like, what's going on with me? Oh, they shake it off and they stop normally.
Mm-hmm.
Please, you need to get to the hospital within 30 minutes of that happening.
Hmm.
Any You're talking to any elderly person and they can come like, my mouth is moving to the side, my speech
Hmm.
is changing. You have to act fast.
Right.
Yeah.
Somebody is
So
asking a question here. What about scalp headache?
no, I can read. Is it sharp or scalp?
Oh, sharp. Is it sharp? Oh, sharp. What
Sharp.
about sharp headache? Yeah.
Okay. Now headaches can be caused by several things. It can be caused by dehydration. It can be caused by normal like tension, stress. Now, this are what I'm telling you now are red flags, things that would, when you get to A&E and you tell anyone, they will turn you back home. Now, this is not to make you now start over seeking health, the health service care. It's more to empower you to know what to ignore and what to address on time. Any
Mm-hmm.
other headache you can see the GP, you can have, we have migraine, we have tension headache, we have no anxiety, even some medications can cause headaches. Yeah, but these particular ones I'm telling you,
I'm still here. So just if you see my camera go off, don't worry. Just keep talking. I'm here.
all right. Yeah, so I've described 5 things that can either be meningitis, um, a stroke or an intending stroke, especially the ones that come with the speech changing or mouth drooping to the side, or you start experiencing some numbness or facial weakness to the side. The thing is, the body will give you the sign. Most of the time, it happens and stops. It happens and stops, and then it hits really big. So I've given you 5 things to watch out for regarding headache. Now, the eye. A lot of us, as we get older, we tend to wear glasses. It comes with aging. However, if you realize that you've got sudden redness and pain in the eye, please, it's a medical emergency. Don't use anything and hold on. You don't want to lose your sight. So any
Sudden
sudden
pain,
on
sudden
yeah,
pain
yes,
in the eyes or
yes, and
redness.
or redness in the eye needs
Okay.
urgent attention. At times, people would say they can see a cotton drop. That's the usual pattern. They can see a cotton drop, like a black cotton dropping. At times, when people have got raised blood pressure, they see floaters or cotton wools in the air. That at times we can manage, we can control over time by reducing the blood pressure. However, if you see this particular thing, like a cotton dropping, or suddenly you lose the eyesight and you regain it again. So someone will say, "Oh, I couldn't see in the morning, but I prayed or I did something, I drank water, and the eyesight came back." It's a warning sign. I'm trying not to name the diagnosis or the, but just have this at the back of your mind for the eye. Every other thing for the eye, we can wait a bit. But this pain or redness, especially if it's affecting one eye, if it's affecting both eye, it might be due to viral infection. We call this conjunctivitis, itchy, redness, teariness. But if it's just one that is suddenly painful and red, yeah, let's do that immediately. Now let's go to the nose and the throat. Now we've got common, like, viral infection is everywhere. At times it can come with sore throat, loss of voice, but usually the pattern is for you get better within 1 or 2 weeks. You get better. Now, if you're having in the absence of a viral infection, you suddenly start having change in your voice. You're having hoarseness. You're having a long-standing cough, more than 3 weeks, 4 weeks, and there is no viral infection. There's no fever, nothing, no catarrh, nothing. It's just persisting. You've used everything, it's still there. Or sore throat that is just constant, especially if you smoke cigarette. You see, this could be a sign of laryngeal cancer. So it's something one has to see the GP for immediate, or the family physician for immediately, so that
What
you
kind
can
of cancer was that again?
I'm trying not to name it. Laryngeal cancer, cancer
I
of the
don't.
throat, cancer of
Cancer of the throat.
cancer of
Okay,
the
I
throat.
don't think I've heard
Yeah,
that one before. That's what I'm
yeah,
asking.
cancer of the
Yes, sorry.
vocal cord. Yeah,
Okay.
but commonly in people that smoke cigarettes, when they start coughing and the cough lasts for more than 3 to 4 weeks, we explore something called COPD, the chronic obstructive pulmonary disease, or lung cancer. So long-standing cough in with a background history of smoking needs to be explored. Don't just keep dousing it with Linctus or whatever. As long as it's not related to any illness or maybe infection, that is a sign of a lung pathology. All right, so we are moving down to, let me skip the mouth and the teeth. We can come back if you have time. Let's go down to the lungs. I've talked about the cough lasting for more than 3 weeks. Now, if you have any, are you there? Can you see
Yes.
me now?
Yes, I'm seeing you.
Yeah.
Yeah. I'm here.
Okay.
I was just doing
All right.
something in the background while you're talking.
All right. I thought I was disconnected.
No,
All
no,
right.
no, no.
So, okay. For any reason, if you've got blood in your phlegm, you shouldn't have blood in your phlegm. Don't just say, "Oh, my throat was irritated." Anything that makes you find blood in your phlegm needs to be
That's
explored.
that's coughing out blood. If you cough
Yes.
blood, yeah. Somebody
Yes.
before you go on, no, somebody saying something. Stephanie, one of our darling aburos here said, "I see floaters. My eye doctor says it's normal as we age."
Slowly.
This is a young woman.
So we need to check our eyes as we age. The eyes will change. You can see floaters or cotton wool in the air.
How
At
old are
times,
you again, Stephanie? Are you not 20 something? Which one is as we age at 20 something? I don't think she's that age yet, though. Should
No, you
she
need to check
be looking at this further? That's what I just want
so,
to find out.
yes, she needs to check and screen for diabetes and of course
She's
check her blood
27.
pressure.
Yeah, she's
Yeah.
27.
Yes, so we need to check our eyes regularly. I will still talk about those screening. That's where the eye checks will come in. Every 6 months, you need to visit the optometrist and
Yeah.
check your blood
Another
pressure.
person. Yeah, another person saying
Yes,
I'm seeing floaters as well. Okay. All
yes,
right.
yes. We need to check our eyes. All right.
Okay.
So back to the lungs. I've talked about I've talked about the smoking and any form of phlegm. Yeah, any other thing can be explored as a cold case. Now let's talk about the heart. We're about talking about the chest now. Any family, if you've got any family member who has deleted
Deleted. Mm-hmm.
less than 40 years old, please, before you clock 40, ensure that you have not ECG. Don't request for an ECG. ECG is like the electrical tracing of the heart. It's those wires that they stick around your chest and your hands. Don't request that. Request an ultrasound of the heart. Now, let me tell you this. I'm sure you've heard about people that would come talk about people that their family getting deleted. I'm the only surviving person deleted.
Yeah. Yeah.
In fact, there's a particular actress who mentioned this 2 weeks before she deleted she I don't know what to use. So
Oh my God. Am I the one frozen or is Dr. Ade that is frozen? Oh dear. Because I'm not hearing her. I might be the one that is frozen. Guys, can you hear me? Because I think her screen, I can't see her screen. Is it Dr. Ade? Okay. All right. I don't know what's happening. Okay. Let me take her off and put her back on. Okay. I thought I was the one because sometimes these things happen. Let me see. Her internet is, uh-oh. Let's see if we can get it sorted. Okay. She'll try and join again. Please, this is very, very important too. We are doing something that can potentially save people's lives. So give it a thumbs up and share. This video is very, very important. This is something that life-saving information we're sharing. Give us a thumbs up. Welcome back, Dr. Ade.
all right, sorry about the glitch. Yeah, so I was talking about the heart and the pattern. So we've got something called HOCM. It's called hypertrophic cardiomyopathy. It's a medical word, but it runs genetically in families. So there's a particular I was talking about the actress who said had lost like 7 siblings and they had the same pattern of deleting. And 2 weeks after, she deleted almost the same in the same pattern. When I listened to that show, I was, how can I reach out to this lady? So the thing is, if that pattern exists, whether in your family, maybe your nuclear or extended, please just give yourself that gift before you're 40. Request for an echocardiogram. It's an ultrasound of the heart. It's going to check how thick the heart muscles are and check your of course they would do other things because once you do that they would refer you to a cardiologist. Just let the GP know. Yeah, so it's not an electrocardiogram, not ECG, echocardiogram.
Yeah, I think BBY just put it here now.
Oh yeah,
Ultrasound of the heart, also known as you people will not break my teeth with
echocardiogram.
echocardiogram.
Yes, yes. So that is it. And then before you register in any gym, a lot of us want to lose weight. Please do the ECG. Do the ECG because a lot it is not everyone that can take up that exercise stress load that at times the body is willing. You really want to exert yourself, but the heart might not be willing. So just try. I don't know how. Maybe if you speak with a GP, some GPs are good enough. They can do that for you routinely, or you can do it privately. It's just something to do to be sure that your heart is strong enough for that activity you want to embark on we know if you have been doing that from when you were young, then your heart would have conditioned, but not all of a sudden, boom, you just start doing that. That's not advisable. All right. So what we advise is 30 minutes of light exercise. And the way to know when it's enough is when you are too breathless to sing. When you are too breathless to sing, then that's enough. So don't do the exercise until you can't talk again. When you sit down, like, ha, ha, ha. No, 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 that's too much. So we always say 30 minutes every day until you are too breathless to sing, not to talk, but to sing. All
Right.
right. Now, if there's any unusual awareness of your heartbeat, you shouldn't be hearing your heartbeat. But if you can hear bum, bum, bam, something is going wrong. It needs to be checked immediately. And now, if you have any left-sided, now not right, left-sided chest pain, you need to have an ECG done within a week.
Somebody is
So,
asking a question. Please, if you want to ask her any question, just put Q before you ask so that I can know. All right? Because we have a lot of comments. I want to be able to pick out the ones that are questions I can put forward to Dr. Ade. Somebody
yes.
is asking a question about the eyes. I think they're still taking you back to the eyes. That what if what's that question? I saw it. I think the person was saying, what if you can't see at all without glasses?
Okay, we will address that in a bit. So,
And somebody was saying, what is MRI? What does MRI? What does it do?
MRI, magnetic resonance. Okay, I will talk about that in a bit.
All right.
I
Okay.
would answer the questions all at once.
All
Okay,
right.
so I'm trying to go system by system. So for the heart, any chest pain, if it's on the right side,
Mm-hmm.
um, we are not usually worried. But if it's in the left one,
Mm-hmm.
moving to your jaw, moving up here, it's usually then let me tell you something about chest pain coming from the heart. It is not a pain that you can point to. It's not a pain that
Right.
you can say this is where this is what. It's everywhere. It comes like something hits you, boom, and then it moves up to the jaw, to the arm, down, and then you feel sudden sweats. I'm saying this specifically so that we wouldn't miss it, because this thing happened insidiously. It starts before the big one happens, boom, you would have seen signs. So it's not something that you will say, oh, my rib here. Once you start pressing here, no, 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 it's not from the heart. Left-sided, generalized. You
Mm-hmm.
don't know what's up here, and then moves down to the hand, and then
Mm-hmm.
you have this sudden sweat. Don't ignore it. You need to go and don't. And when that happens, please don't drive. Just stop what you're doing. Call a taxi. Do not drive.
Mm-hmm.
Yeah. So let's move down. Let's move down to the tummy. No, no, no. Let's move to the breast. I've talked about the lungs, the heart, and then the breast. Okay. Before I continue, please, men also do have. I don't breast. Can I use breast here, or can I?
Yes. Yes.
Yeah,
Yes, you can.
yeah.
Mm-hmm.
Men also do have breast cancer. So this is for both female and men. Um, of course, we know about the lump check and all that. Now, if you have any lump on your breast, get it checked by a doctor. That's common knowledge. Now, if there's any thickening of the skin around the breast, it becomes dark and thickened like eczema. It's not a good sign. Now, if there's any, aside a lactating mother, you shouldn't be having any nipple discharge. Nothing at all. Either milk, either blood, either pus. Don't hide it. Don't say it's hormonal or I ate something. Just go
It's my
straight.
village people. What about spiritual problem?
No, no. So those are the things that we do immediate mammogram for. And the outcome between A and B is about the time of presentation. Now, if there's any lump underneath underneath the, we call it armpit, the axilla here,
Mm-hmm.
it can also be a sign of breast cancer. So when you're checking, extend your hand here and check underneath, both
Right.
male and female.
Men can have breast cancer as well.
Yes, yes, yes,
I
and
never
that
knew that.
yes, and that is even more serious.
Wow.
Yes,
Wow.
and if you have
Formation.
yes, and if you
Formation is power indeed. I never knew. I thought it's only women that can have breast cancer.
yeah, men can have it, especially when they've got a family member that's got breast cancer. So there's a gene, it's got the BRCA gene. It can run in the family.
Right. Somebody
Yes.
asked this question. Bless said, what about chest pain in the middle of your chest, like between your shoulder blades?
Okay. You see the way I carefully described that left one. If it is not similar to that, that one we can check what's going on. Could it be peptic ulcer? Could it be gastric reflux? Anything can happen. It could be from the liver. So anything can refer. The nerves are connected everywhere in the body. So you can have something going on somewhere and you'll be feeling the pain in the chest. It could even be anxiety. But this particular one I just described, today is for red flags, things that you should not miss at all. You should be very aware of. Yeah, but I would answer other questions. But middle of the chest, nah,
Okay.
I'm not
Okay.
worried.
Can you do that? Can you describe it again once more for those that missed it? Where is the pain for the
Okay,
heart now that people need to
so
really run to the A&E and run to
yeah,
emergency?
so the heart is on the left side of the chest wall. It's here on the left side, down here, down.
Is it
So when
under the breast or on top of the breast?
it's it runs across. I don't know if you can see me
Yes. That's better.
from here to here, from here
Okay.
to here.
Okay.
Now, when the pain starts, number one, it is not a pain you can touch. If now you can see she mentioned the middle of the chest. You can see I
Yes.
mentioned what you can point to that middle. It's not from the heart. If it's
Yeah.
from the heart, it's like someone dropped something, boom, on you. It's
Yeah.
we call it, how do I call it, thunderous, boom, and then
Mm-hmm.
it moves up to the neck here and goes down to the shoulder, and then you suddenly feel sweaty.
Sweaty. Yeah.
So it's not something you can miss. It's not. It's like a thumb on your heart, boom. Yeah. So oh, someone is asking, what about making discharge 1.5 after? Oh, no, I said as long as if you're lactating, then that's hormonal. But
Are
if
you
you're not,
still are you still lactating? Are you still breastfeeding? If you're not breastfeeding, then maybe I don't know. He said 1.5 years. Some people still lactate after even up to 2 years. So I don't know.
yeah, people still, it's due to the prolactin on the body, and you still have the appointment with the I think the perinatal nurses afterwards, so they can check you. They can check
All
you for.
right.
All right.
Okay.
So that's for I've talked about the breast, the skin changes, the lump, and
Mm-hmm.
no discharge. Yeah. So
Mm-hmm.
for the tummy, now if there is any change in the bowel habit, everyone has got a bowel movement pattern. If you just notice that there's a change, constipation alternating with diarrhea, and associated. Now that can come with maybe your diet, maybe the way you feel. At times you go to a new place, you just realize that you've not settled down and your bowels are just not moving the way it is. So there's some things
That's
that,
if you are not going to toilet properly, you are not able to go to the toilet. Hey, yagbe. I want to break it down so that everybody can get it. You are using a
yes,
lot of baby grammar that some people might not get. So let's be able to,
okay. Okay, so if you're not going to the toilet as
mm.
your usual pattern is, for example, if you start having constipation for 3 days and then you now have diarrhea for another 3 days, and it's changing like that, and you now experience something like maybe weight loss, which is not intended. At times we feel that as one gets older, we always use this word that we shrink. Now, I will say something about weight loss. It's not ideal to lose more than 10% of your weight in a month. In a month,
10%.
yes. So if you are, let me say, 100 kilograms, and you move down to 90 kilograms within a month, that's not a good sign. That's not a good sign. So we shouldn't just look at someone and say, oh, you're getting older, you're shrinking. Now I will talk about something. I don't want to jump. So if you're experiencing any change in your usual toileting pattern and weight loss and or rectal bleeding via the bum bum, you
Oh, ho,
shouldn't be
ho.
You shouldn't be you shouldn't have any form of bleeding.
Okay, like when you go toilet, you shouldn't have
No,
any bleeding there. Yeah.
no. Some people have piles, we call it piles, like hemorrhoid. At times
Mm-hmm.
that can bleed. That's a long standing, people can live with it. So if you don't have hemorrhoids and all of a sudden you start seeing your stool darkened with blood, you need to run. It's a scream point. And another thing I want to talk about, I want to mention something about pancreatic cancer. Now,
Hmm.
that cancer, I've not in my life, I finished medical school almost
It took
14
my
years.
uncle's life last year.
Yeah,
You know
it's
that burial I went to Nigeria for was my uncle, and they didn't detect it until he got to the US. And when they detected it, he lasted 2 weeks,
just
then he was
2 weeks.
gone.
Yes.
Yeah.
So the shortest I've seen and I've read about, I've been a doctor for almost 14 years now, is the shortest, the longest I've seen someone live with pancreatic cancer is 6 months. That's the
Wow.
longest I have seen. But I've heard of 2 weeks, 10 weeks. It's a very deadly diagnosis. Now,
Yeah.
let me tell you the signs. People, they would say they don't have appetite. They start eating little. They start taking little, just easy. They get, I'm trying to use, they get full easily. And then they start losing weight, which at times people feel is good. I'm losing weight without so much effort. One thing about it is the jaundice, the yellowness of the eye. That's one sign. In addition to what I've just mentioned, then they can start. Then there's a particular thing that happens. They have new onset diagnosis of diabetes.
So
So
jaundice is a symptom of pancreatic cancer.
jaundice, new onset of diabetes,
Mm-hmm.
easy satiation. You just start
Getting
eating.
full easily. You eat small food, you
You
are
get
full.
full, yeah, you get full easily. Nausea and vomiting. So that nausea and vomiting, you just feel, like oúnjẹ see me. I really don't want to take anything. They just start taking themselves away from food.
Mm-hmm.
Before you know it, that is it all. Yellowness of the eyes and new onset diabetes. That's it. So it's not a common symptom like abdominal swelling, boom. No, it's just very silent, very silent. And once people get, so that's the reason why it's usually peaked very late, because these signs are not. eh, I can say I'm eating 2 plates. I'm just not eating. You won't think about that, but once you see that you're losing more than 10%, that's a catchword. That's not a good thing. It's not a good thing at all. So let's move
Mm.
on to heartburn. Any long-standing heartburn. Heartburn is very common. When people talk about peptic ulcer, gastric ulcer, we use our antacid and we feel better. Now, if there's that heartburn that is resistant to treatment, you've used everything and it's not curing it. Please, we don't. I don't want to mention the names of the cancer. It's not a good sign. So I see
Heartburn. If you're
heart
having heartburn and it's not clearing and it's
we
persistent,
are taking antacid, you're taking omeprazole, it's still there. You've taken antacid, you've avoided spicy food, you've avoided alcohol, everything, and you're still having heartburn. Please go to the hospital.
does that also include indigestion?
Indigestion, you would know the pattern. You'll be able to identify the food that is causing the indigestion. Some people react to maybe wheat, some people to milk. So this particular heartburn, you have used everything. You've explored the indigestion, you've excluded the food, and it's still there. Resistant to treatment and lifestyle changes is not a good sign.
Right.
So I've just told you 3 things from the tummy: the heartburn, the pancreas, and also the bowels. You shouldn't be having any bleeding in the stool. Now, if there's anybody in the family who have deleted due to colon cancer, please, if you are a man, once you are 40, you need to have a camera test.
Hmm.
You need to tell the GP. when a lot of us moved in our prime, so we don't have all this previous record. By the time you come here, you just register. Usually, you won't tell them all these details. But here they have everything. People, they have their data. So you are the one that will have to tell them all this. This has happened, that has
Yes.
happened. So that they
Yes.
will schedule you for the checkups that you need. Yes, so that's for the bowel, because the bowel is from the mouth to the anus. So I've just run through the important part. Now let's move to men's health. Men's health. When I say men's health, it's more of the genitals and what's particular to men. Now, if you start having any visible blood in your urine, that's not a good thing at all. You shouldn't be seeing blood in your urine. You
For
need to be,
men.
for men, you shouldn't be seeing visible blood in your urine. It's if it's dark colored, maybe we can send it and check for the blood we can't see with our eyes. But frank blood, no. Now, if you're waking up more than usual, like 3 to 4 times at night to pass wee, now listen to these four signs. You need to, when you get to the toilet, you take time before you start the stream. You have to. It's not like you're straining. It's like you want to wee, but the wee is not coming out. It's taking you time before it comes out. Then, thirdly, when you get to the toilet, you find out that you have to rush. If you don't rush there, you wet yourself. Fourthly, you pass urine, but you feel that there's something remaining there that you have not gotten out, or like there's a retention. Basically, if you're greater than 45 years and you're having this, it might not be a symptom of prostate cancer, but it might be that the prostate is enlarged and
Right.
it's squeezing the urine tube. So the urine tube passes through the prostate, and as they get older, the prostate gets bigger and starts squeezing it like that. So when this happens, don't resort to herbs. Don't start drinking water. Don't say you're flushing out your system. It could be that the prostate is big and you just need some medication to relax it.
Mm-hmm.
And we, in such cases, we check for the antigen. We just screen people with such symptoms for prostate cancer.
And this is very common among black men.
Yes, prostate cancer. Yes, it's very common. Yeah. So that's for
Okay.
men's health. Yeah. So for women, now I would name 3 bleeding. If you are bleeding after kerewa,
Mm-hmm.
it's not a good sign. No. Don't.
All
Some
right.
people talk about positioning, the intensity. Any form of bleeding after kerewa needs to be explored. We need to check your cervix. Now, you shouldn't be bleeding in between regular periods. If the periods are irregular, then we know. And for you to know that it's a period, it has to be it flows for like 3 to 5 days. But
What about fibroids? People who have issues with fibroid that have spotting.
now for people that have got at least we know that there's a fibroid there. We've explored the bleeding. Now, some people, I'm talking about people that don't even know what's causing it.
Okay.
Yeah. So any bleeding in between periods needs to be explored. So we send them to the gynecologist for an ultrasound, and then they do some tests to be sure that there's no issue. Now, the most important one is bleeding after menopause. After menopause, you shouldn't bleed after that. If you are on hormone replacement therapy, it's usual to bleed, to see some spotting within 6 months of starting the hormone replacement therapy. However, after 6 months of starting, if there's any bleeding, we need to check the womb, the uterus, because it could be a sign of endometrial cancer.
Someone is asking a very good question. Thank you so much, Dr. Ade. You are doing fantastically well. There's a reason why I love you special. You are amazing. You are like a walking encyclopedia. You are so knowledgeable. On top of this, you're plenty beauty. Thank you so much. You are
Thank,
the full package. Thank you.
thank you.
Somebody is asking a very good question. Grace found me said, what do you say about women that are bedwetting above 30 years of age? I know you haven't reached there. You are still in the belly and organs, but
Yeah,
I think this is a very good question.
I can
Yeah.
talk about this. So for bedwetting, if it's it could either be um it could either be, we call it organic, sorry, it could either be something from the structure of the bladder and the organs and the bladder, the kidney, and all that. And that you would have, the woman would have had it since when she was born. If there's a structural abnormality, then that's on one hand. Now, if she suddenly starts bedwetting after 30 years, maybe she has been dry before, and it
No,
just happened.
I think he's talking about people that have been having that issue since when they were children, and it never stopped
When they were
till after
children.
30. Yes, because I've seen one before when I was in uni in Nigeria. It was an issue, and she was just praying and praying. Yeah.
Okay, so in such cases, we usually refer them to the urologist, and then there are lots of interventions, lots of that surgical or medication, but it's
Hmm.
something that people shy away because of maybe the stigma, shame. But there are things that there are medications that can help.
Okay, so guys, can you please, because I don't want her to break because she's going systemic from head to toe. I don't want us to, make her look focused. Leave the questions till when she's finished. Then I'll take the questions, right?
Yeah.
Please, all your questions are valid. We'll try and get to them, but let her finish because
Okay.
she's still talking about the health, the red flags. So let's continue.
Yeah.
Then we'll take the questions later.
Yeah. So I've talked about the bleeding after menopause, 6 months after starting hormone replacement therapy. Now, for ovarian cancer, watch this forward. If you start experiencing abnormal bloating, just your tummy becoming gassy, big, and then there's this lingering back pain and weight loss, don't ignore it, please. Don't ignore it. So at the end of the day, they just the way the woman usually presents is very slim, very thin, with big belly.
Mm-hmm.
But they'll just feel that, oh, it's just gas, it's gas. The ovaries is like cyst, is full of eggs. It's not something that you might not be able to touch it like a lump. It's just gets it presents as bloatiness, gassy, weight loss, and pelvic pain. Is usually the ovaries are usually is at this part here.
Okay.
So if
Yeah.
there's pain around that area, we need to check it on time. Ovarian
Right.
cancer, ovarian cancer. Yeah. So I've so that's red flags for women. I wouldn't there are several things that can happen, but let's just leave it at that. Those are the ones that we cast the beam light on. Now let's talk about the skin. The skin is the largest organ in the body, and a lot of people yeah, we use a lot of things, products, creams, soaps, and all that, and it regenerates on its own. Now we've got some lesions, some swelling, some acne, things that we can live with that are not worrying. Now let me tell you something about the skin that we should watch out for. At least once in 6 months, check your body, look through your skin, look for any new spots, any new mole, like a raised black spot. It could be at the back. At times when some people get older, especially men, you see some tags, some skin tags, uh,
Yeah.
yeah,
Yeah.
around. Yeah, and they're
Yeah.
like, I don't even know when it happened and all that.
Yeah. Mm-hmm.
Now, it's not all of them. Some you can live with. In fact, most you can live with. But
Mm-hmm.
listen to this signs. If it starts to change in size, so there's some things that you see that have been there for a long time, and it suddenly starts changing in size. And the size change is not regular, is irregular. Maybe one is growing up here and that one is growing to the side, and then it starts changing color. It becomes you have like purple color, purple to red, and you're like, what's going on? Purplish red.
Which part of the body is it usually where? In the face?
Now we've got some at the back, we've got some on the face, anywhere, and that's why I always say people should check the skin. Just look back and forth. It's just like a skin check because you use a lot of things that contains chemicals. Of course, when the body will do what it wants to do. So there's some particular modes that you can live with. It's not every change that is worrying. The ones that are worrying would come with this particular changes. So it would be a long-standing or maybe a new mole that is changing or growing irregularly. We
Mm-hmm.
usually ask about, look at the shape, irregularly, or suddenly start to itch or bleed, or pain, an irregular sensation. One thing I want you to, if you can check it, malignant melanoma is very deadly. It's
What's that? The
so
the growth. Is
yeah,
that growth?
skin cancer, skin cancer. So
Oh, right, right.
if you have any changes in an existing growth or swelling that is changing in color, in size, in shape, now maybe discharging, just or developing hair, or start growing hair around it, it's something to scream about.
So basically, if you have any growth in your body, you need to take it seriously and
No, no,
observe.
no, no.
Is that?
There are some that would come in the skin. Now,
Uh,
when older, you will have tags, you have changes.
mm,
There are some
mm.
we can live with. Now, if one of those many now starts to have an irregular growth
Right,
and associated with change in the color, now becoming tender or having hair on top of it, you're now finding, what's wrong with this mole here or this pimple here? I can see hole, and it's growing, it's changing. You
as
need
if it's
to,
changing. It's not just regular skin tags that
yeah.
she's talking
So
about.
it's not just regular
Stephanie,
skin tag.
no, it's not regular skin
Yeah.
tag. She's talking about if there are changes, like if it's growing or there's anything coming out of it. So
Yes.
listen, yeah?
So it's not, there are some you can live with that would all that have nothing, not just normal changes in the skin.
Mm,
All right. So back to the bones, the joint, and the limb. This is very particularly important for children. If you find out that there's a child, you have a child that is avoiding using a particular leg, or limping all of a sudden and having fever, it could be a sign there's something called osteomyelitis, infection of the bone.
right.
Yes. So if the child is just suddenly limping, please don't, before we say, are you lazy, or you been a, no, it's a huge sign. Of course, it comes with swelling, pain, but
Mm-hmm,
most of the
mm-hmm.
time, the what we look out for is it a sudden limp, just limping. Now for the grown-ups, if you've got any, so a lot, back pain is one of the most common symptom we talk about. Back pain, back pain, back pain. So if they ask everybody here, do you have back pain? We will say we have a degree of back pain. Now,
Mm-hmm.
what are for the red flag signs? If there's any progressive retention, inability to pass urine, or loss of bladder control, all of a sudden you just start wetting yourself,
Hmm.
that is a sign of something going on. Now, I'm talking about back pain. So for anyone that says I've got back pain, these are the questions I ask the person. Do you have the ability to control your urine and bowel
Mm-hmm.
movement? If the person
Mm-hmm.
says no, I can see that I'm swelling myself. I'm just swelling myself. I don't know what's going on. Oh, so when did that start? Oh, like 5 days ago. Oh, so what have you been doing about it? I've just been using some adult pads and just helping myself, because they
Mm-hmm.
don't know what it means.
Yeah. Somebody
Yeah,
is asking a very good question here. Dr. Ade, God bless you. Thank you so much. Somebody is saying, because this is something that is very prevalent in our community. Yeah, Lucas is saying, please talk about kidney disease because many people are deleting.
yeah. I will talk about that in a bit.
Okay, thank
After the
you.
bones, I'll talk about the kidneys. Okay.
Mm-hmm.
So if there's any inability, now when you go to the toilet, you wipe or you wash with water, and you should be able to feel your hand against your groin. If you cannot feel the sensation of the tissue or your hand, then there is a problem.
Mm-hmm.
Now, if there is any sudden leg weakness or loss of sensation, now you have to get to the not GP, A&E immediately, because they need to give you steroids. They need to stop that progression, because
Right.
one can lose the function of and become paralyzed.
Is that stroke?
No, no, it's called cauda equina syndrome.
Lobaton.
Yes. So if there's back pain and you're now having that what I've just mentioned, it looks very simple. Like I'm just not feeling what's happening here. I don't.
Mm-hmm.
Or yeah. So if there's no sensation or weakness or tingling down the leg, you have to go immediately.
Okay.
Yeah.
Thank you.
So that's for back pain. But any other back pain, we are okay with that.
Right.
You can cope with physiotherapy. You can cope with some painkillers, and yeah.
Mm-hmm.
All
Yeah.
right. So the
If I can
kidney,
just say something, I don't have any medical knowledge, but I've been told that if you walk sitting down, the way you sit can affect, your back. Like some people are used to slouching. I'm always telling my husband, sit up, sit up, sit up, It seems
yes,
like I'm telling him what to do, but I know he tends to do like this. But I've been told that you need to sit up like properly, like chesting out like this, so that your back is straight.
it's straight.
That
Yeah.
if you slouch, it has a way of giving you back pain long term. If you are working every day, like if you sit down to work for 8-10 hours a day, that
Yes.
your posture, the way you sit, can give you back pain as well. So that's my non-medical knowledge.
Yes. And another thing I want to add to Sister B's advice, you can support yourself with ergonomic chairs. So there's some things we the buy. Hello, I'm sorry. Thank you very much. Yeah, go and meet your sister. I'm in a meeting. I have too. Yeah, thank you. Can you? Thank you. Bye bye. Can I put it under my pillow? Yes, I'm sorry. I'm so sorry.
It's
My
okay. It's okay.
all
We
right.
understand.
Yeah. So we're talking about the ergonomic chairs. Some and then there's some lumbar braces. So usually we see the physiotherapists to prescribe these devices, especially when you work long hours on
Mm,
computers. Don't use the regular chairs. Ensure that your chair and your table is ergonomic. That's and then when you sit like as if there's a paper or egg on your head. That's how I
mm.
maintain my.
Yeah, I usually just chest out. I just chest
Yes,
out. That way I make sure that my back is straight. That's
yes,
what I do. I think it's easier when you chest out like that. If you are always conscious of it, that sitting down, you should chest out. It helps your back to straighten up. Because
exactly.
when we're young, go ahead, my darling. Attend to her if you need to.
No,
We
no, no.
can't.
I just closed the door. No.
Oh, okay.
Yeah.
When we're young, our mothers told us, oh God, the things that we endured, you don't want to know. When we're young, can you believe this, Ade? My mother used to practically, it will give you correct slap for doing like this. He said, why are you chesting out? That you shouldn't chest out. That do you want boys to be seeing that you have all this tiny, tiny breast on your chest? I said, "Gbami." So
No, 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 no. So
African mothers, oh Jesus. So whenever my mom is around, I will not do like this because it won't seem as if I'm trying to attract boys. You understand?
yeah,
Mm-hmm.
yeah,
All this one
yeah.
is not for you. It's for you not to get pregnant. All this wahala. It's for you not to teenage pregnancy. Chai. Oh, carry on, my darling. God bless you.
Yeah.
Mhm.
Brilliant. Now for the kidneys, um, I'm sure it's not it's common knowledge that we always advocate against herbal concoctions, all this organic stuff, because most of the things we put in our mouth and on our skin is metabolized either by the liver or the kidney. Like it's processed by the kidney, and
Mhm.
at the end of the day, it can fail because of a lot of toxins in the body. And I don't want to go into antioxidants and things like that. There's so from my knowledge, the chief cause of kidney failure or kidney disease, either maybe cancer, maybe family pattern, but the main one is by ingestion of toxic materials, toxins, and maybe mercury creams and all that, hydroquinone. Now,
Hold on a minute. Oh, I've heard that name before. Hydroquinone. Is that not the ingredients they use to make bleaching cream?
no, people take anything you take into your you rub on your skin gets absorbed, and it goes into your body.
Really?
Anything you take, the skin is the largest organ.
So you
So
mean the things that
anything
we
you
put in our skin, including cream, it goes into our liver and our kidney?
yes,
The baton. I didn't know that. I hold my
yes.
hands up. I didn't know that. Wow.
It does. It does. All these toxic metals. It does.
Because you know when you talk about organ, we are always I someone like me is always thinking about only the things inside. I don't think about the external ones like the skin.
Ah,
Wow.
no, 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 no. From the skin.
No
Yeah.
baton.
Yes.
They use this hydroquinone in bleaching cream, so it means that if you put it in the skin, it still get absorbed in your organs.
Yes, it does. It
Okay.
does.
So
Yes.
somebody earlier said that we should talk about the impact of bleaching cream. You have your answer there. All right. Let's
Yes.
go on.
So,
Mhm.
yeah. So what we usually advocate is for you to drink lots of water. But the red flag signs for the kidney. First, there's the kidney is behind the just one here at the back here. Let me show you. So we have the back here and the back here. So that's where the kidney is. If you're having any pain
It's
at
at the back,
the
near the bum
loin,
bum.
the loin
It's
is
near the
here.
bum
Here.
bum.
I'm trying to show you here.
Here, here. Okay.
Yes, yes, yes. So if there's any
Okay.
pain there, it could be from the kidney. Another is it could be blood in the urine. Um, not in fact, no urine at all. Some people can just start having very little urine being produced, and before you know it, it just packs up. And now we now have some signs. You wake up in the morning, you find out that your whole face is puffy, the eyes all puffy, and the legs swollen. And then during the day, it wears off. You need to see the physician immediately. Um, there's something called urea that builds up in the body. It's something that should be excreted. If it builds up in the blood, you can start having sudden itching or darkness of the skin. So it all shows that the kidney is not working as it should. So you
Hmm.
shouldn't wake up in the morning with serious. This one is not bloating. It's not the one that you after washing your face it goes. The eyes will be big, the puffy everywhere, puffy. You round moon face, and then the ankle swollen.
Hmm.
So let me leave you with those three signs for
Okay.
signs of kidney failure. When the urine, when you're not passing as much volume as you're
Hmm.
used to, it's just getting little by little. That means that what's supposed to come out is being retained in the body. And that is what is now making the face swell and the legs swell the way it is. And then the
Right.
hands too. The hands too will swell.
So our lifestyle definitely has something to do with all this.
Yes, yes, it does. Yes, it
Okay.
does. Yeah. So
Okay.
there's some things. So there's some things that we call nephrotoxic nephro. So the medical word for kidney is nephrotoxic materials. Yeah. All right. So let's talk about mental. I don't know what about mental health. Now we've talked about depression, low mood, crying for more than 2 weeks, loss of interest in
This
hobbies.
is a master class, so guys, you've not even liked it. Maybe I should tag Dr. Ade to go because you guys come here to collect knowledge every day. No super chat. It's only Amaka. Amaka is the only person that has been gracious enough to give super chat. Even to thumbs up, gone wahala ni, and you are getting free. This is what they call master class. This is not video. This is not YouTube video. This is not blogging. This is
Yeah.
this is content that you paid for. So please,
Yeah.
please give the video a thumbs up and give us super chat. Jọ̀ọ́ torí Ọlọ́run. Thank you so much. Wow, you are even going to mental health. Wow.
Yes. I want to talk about this depression because life happens to every one of us. Low mood is normal, is usual, but it shouldn't persist for more than 2 weeks. You shouldn't find
Hmm.
yourself crying unconsolably for more than 2 weeks. Of course, bouts can come maybe
Mm-hmm.
in the situation of grief. There's no template to grieving. There's no time people to that. So we understand that that can persist. However,
Mm-hmm.
if there is something causing loss of interest in things that you usually enjoy, people that go
Mm-hmm.
out over and bed, you just want to stay indoors, you don't want to see people, you go to work, you are losing concentration on most
Mm-hmm.
days. Now, If it's lasting for more than 2 weeks, please don't just shake it off. You need to see a doctor. Now, let me talk then sleep problems. You find out that you can't initiate sleep, you can't
Hmm.
start sleep, or when you're
Hmm.
sleeping, it's disrupted, or you wake up in the morning, you feel tired. If it's lasting for more than 2 weeks, now 1, 2, 3 days, okay, maybe you're having an exam, okay, stress reaction, grief, we can consider it. But if this
Right.
happens now, let's move to the suicidal to the deleting risk. I usually ask people these questions. Are you able to keep yourself safe? If the person says no, that's a big one. No. Now, are you in the possession of an equipment, something for deleting, maybe this or knife or something, and the person says yes, that's a huge one. Now, have you felt like doing it? And the person says, have you written the plan down? And the person says, I've written exactly how I will do it. So when you see people that post all these things on social media, now they've got to stage 5, that they felt, they know exactly what, and they've written it down. Now, do you feel life is worth living? And people
Hmm.
just say no. Ah,
Hmm.
that's a big one. So it's not about me. Before they get to my desk, they must have told 1 or 2 people that will tell them, shake it off, let's pray together. Don't
Hmm.
worry, man up,
Hmm.
man up.
Hmm. Hmm.
No. Anyone who has written the way he or she wants to be deleted, that's a huge one. That person needs an admission. So it's one of the things we watch out for. I might now I've made this list of red flags. I can share the link with Sis B if you want. It's just for $10. If you want to have it as part of your, you can just have it as something to constantly go through and get yourself acquainted
That's
with.
McDonald's money. McDonald's money. In fact, he can't even buy you McDonald's. $10. Ah, man of prestige. Thank you so much. People are giving me super chat now. Yeah. Thank you, Miss Cole. Ooh, that's a whooping super chat of 49.99. God bless you. Man of prestige just gave me $10. 9.99. Thank you so much. ten
Yeah,
dollars. That's you are giving the information. Please repeat it again. Seasoning flowers. Thank you so much. All the people that are giving me super chat. I see you guys. I heart you. Thank you.
yeah.
So, can you repeat that? You said that you have. What is the thing?
So I've collated everything I've just gone through, and you can get it for $10. Share it with your friends and family. This is Christmas. People will come together,
The
have
things
fun.
so that people can have it and
Yes,
look at it and
yes,
study it to know. In
yes.
case if they have any symptom,
Oh,
they will quickly run and go and look at it.
yes,
Pay. Do I
yes,
need to go to the hospital now that this is
yes.
thing? Yeah.
Buy
Okay.
it for your friends, family, Christmas gifts. I'm sure they will appreciate it. Now, I want to go into the things we should screen for. So I've just talked about screen, like these are red flags. Now, it's not just blood pressure we screen for. Now, I have an acronym called ABCDE. Now, let's talk about A. Of course, we've
Adana,
mentioned
thank you so much. That's so kind of you. And she's been helping people a lot in the comment section. I think she's in the medical field. I didn't know that. Thank you, Adana. $100 super chat. God bless you. That's so generous of you. Thank you, my darling. You are appreciated. Okay.
yeah, so activity burnout. I always we all have our plans, to-do list. This is the end of the year. Everyone is auditing business, auditing life, and all that.
Auditing life, seriously auditing life. Man, we're auditing
Yes,
life, oh, Dr. Ade.
yes,
Kọ́lọ́run gbà wá. How did we do? We are looking at our report card. How are all my plans? How did it go for 2022?
yes.
You
And one
know?
thing we do is that we carry it over 2023. One thing I always tell people is we need to plan to rest.
Hmm.
Rest should be part of the plan, and it's not just vacation. What I always talk about is psychological rest.
Hmm.
The rest that you don't have any deadlines, any debts,
It's me you're
any.
talking to now. You're talking this one, you're talking to me. Because this year, I don't think I've rested. Even the vacations that I took. I said I
Mm,
was going to go on holidays 4 times this year. For
mm,
where? How many did I do? I managed to do only 2. And these 2 that I did serve was no rest because I took my children to Dubai. And it was every day going out and that's not rest. I like the fact that you're talking about psychological rest. Please, can
yes.
you elaborate on that a bit?
Yeah.
Because I need
So,
it. Thank you, Obiajulu, my sister. You are lovely. Thank you for the super chat.
Yeah. So physical in instead of inactivity or doing what you know at times we go for vacation, we just do something different, but the body is still running. But
Yeah.
psychological rest is that state whereby you are in complete, like, how will I put it? There's no deadline, there's no one you're resenting, there's no one you have not forgiven, there's no debt you're paying, there's nothing keeping your, it's like all the tabs in your head, all the tabs on your computer is closed. You don't have lots of tabs opened in your head. At times people go on vacation, but they are even working harder than when they were what
Especially if you travel with children or it's a
with
family
children.
vacation, you don't rest.
Yeah.
Mhm.
So you completely, shut down deadlines, do something so that your mind is at peace. And we need that pause
Hmm.
at least 6 months in a year. We need to plan for it. And everybody has got different stressors. It might be, do I need to take this kid somewhere and just go somewhere and log out of my of social media, log out of this, so that you don't have any tab. It's like you're closing everything one after the other. And I always tell people, as one gets older, let's try to forgive, let out all this energy negativity. It reflects in, it helps with
So
with
unforgiveness and carrying, pain of people
learning,
hurt
but
us.
yes,
So it can also affect our mental health and the way we
and
feel.
yes, it can. It can. It can.
Mm.
And of course, we can also audit our finance. There's something called the parental stress index. Parental stress index. You can Google it to know how stressed you are as a parent. It's not everybody that is actually enjoying the journey of being a parent. And
Absolutely.
yes, so by the time you start, we ask you, are you going to? Do you feel you're the kind of person that want to do everything for your children? And you say yes. Are you? If you are to make the choice again, would you have 4 or 3 children? And you say no. That means you're stressed. You're not enjoying it.
Especially for those of us that live in the diaspora that don't have that additional family support. Thank you,
Yes,
Temilade, so much for
yes,
that super chat.
yeah.
I mean,
So
we work so hard. I want you to talk a little bit more about this rest, this break, because I'm guilty of it too.
okay,
Honestly, I
okay.
feel like the only place I can really rest is Nigeria. For some reason, as chaotic as Nigeria is,
Mm,
that is the place that I feel I go to that I have so much peace. I
mm,
feel like I can rest there for some reason. I don't know why. But we work so hard from January to December because we are trying to meet up one thing or the other,
yeah,
projects that we are doing,
yeah.
family responsibility here and back home. How do you advise that people can actually take a break? Because a lot of us don't take any break. We don't take any breaks.
Okay. I Like I said, everybody has got individual stressors, and there are some that are man-made, and there are some that of course, life costs money. We need to work to run life.
Mhm.
So there's some things we can't avoid. Maybe some. I will still talk about my story someday about my daughter who was diagnosed with
Yes.
autism. Yeah, so
Yes.
that another degree of stress. So
Yes.
yeah, but talking about how we can take a break, I plan for the break and I intentionally work at it. It's like I'm working towards achieving a goal or doing a master's program. I identify what is stressing me, and I meet up. I nurture a relationship that would enable me rest. And I tell them the duration. It's like a project management call. I make sure that I truly detach and declutter my mind from that
Hmm.
response for a particular time. But
Hmm.
most times we don't even have that community around us. So I do it for some people, and people also do it for me.
Hmm.
But it's all individual based. And I do a regular parental stress index score. I have surrogates.
What does that mean? Parental stress index course. I don't know what it means. I'm
Parental
sure a lot of people are
index
with me in
parental
this.
parenting stress index score. Yeah,
Score. Parenting
the score.
stress index score. Score.
Yeah,
What does
like
that mean?
it's just to audit how, because that's a huge stressor in a lot of people in our prime. Anything we are doing is about our children. We go to work for our children, want to invest for the children, we want that for children. So I regularly check myself. how much is too much. I'm always setting boundaries. I shouldn't go above, because if I delete, what's going to happen? They will leave.
It's true.
Yeah.
That's true.
So,
It's
and then,
harsh, but that's true. If you
yeah,
delete, your children will live. They will
yes.
carry on living.
And then
Mm.
the work we do, we also need to understand, um, of course, we have aspiration, which is really good, but everyone needs to understand the cap, how much is too much, because the body keeps the score. It's not everyone that can exert and do three jobs at a time. It's not everyone that
Yes,
can do. Yes.
it's true. It's
So
true.
there has to be cuts and corners for some time.
Hmm.
Yeah. So that's how I usually I have like a lifestyle coach that I am accountable to, because that's how I keep my sanity with everything going on around me. Yeah. So
Okay.
so the B, of course we know about the blood pressure. Um every a speak is a speak It's called this, we call it a sphygmomanometer. They sell it in most pharmacies. It's like 25 pounds. Every family should have one.
Is it the one that we can use to take our blood pressure at
Yes,
home?
yes, yes.
Okay, we have it. Okay, I
Every
have
family
it at
should have
home.
one. And
I have it, but do I use it? Let me let Majen Kuro, let me not lie. I
yes,
don't use it that
yes,
much. I don't.
yes. So we should use it every week, every Sunday. Just check your blood pressure.
Every Sunday.
Yes, it's
Okay,
just
I
for
like that.
regular
It's a routine. You
routine.
set a routine of using it every Sunday.
Yes,
Okay. Thank
yes,
you.
yes. And when the reading is above 135 over 85, then we need to act on it.
135 over.
85, then you need to
Okay.
act on it. Now, for your blood pressure, of course, I've talked about that. Now, the other B, now I'm going A, B, C, D, E, is your body mass index. Now, buy a scale and put in the bathroom and step on it at least once a week.
Oh Jesus.
Yes.
Oh, now you want to
So,
you want to spoil matter now.
yes. So step on the scale once a week. That's another B, because it comes in little by little, 1 kg here, 2 kg here. Before you know, boom. And I know a lot of people don't like seeing they don't like seeing that
I don't I
number.
have it. I have
Yeah.
it. I was the one that bought it, I put it in the bathroom, but me
Yeah.
and that scale is looking at me. I'm looking at it like this,
You
manny.
need to
You
use it.
do this wicked thing. Me, I should come and step on you. Me and this scale used to have fights. We have regular fights.
Yeah, it's the same everywhere. It's the same everywhere, but we need to. But in all, in the process of losing weight, anything that will make you lose more than 10% of your weight in a month is not safe weight loss. So you can
Right.
do gradually. What we advise is 1 kilogram loss in a week, or in one kilogram in a week, or 0.5 in a week, depending on the health status. But between 0.5 to 1 kilogram loss in a week is okay.
Okay, so rapid weight loss is not good.
It's not good at all. It's not
Right.
good.
I didn't
Yeah,
know that though.
it's
Hmm.
not good, because yeah, it's not good. Yeah. Now, cholesterol. So the C is cholesterol. That's the lipids in the body. Now we take a lot of lipids, in butter, in our oils, in our pastries. So this we can check once a year, but we can't do it ourselves. We need to go ask the doctor for our wellness check. Wellness check. Now, another C, immunization. Well, you need to check your immunization status. I just put it as a C. Check
Is
immunization
it,
status.
are there foods that we should avoid because of our cholesterol? Because someone said that our food tend to be very high in cholesterol,
Now, I
especially
wouldn't
with the red oil and all that we we eat a lot of oil.
of oil. Okay, so I wouldn't want to take the place of, maybe that's another one for food, health, wellness, and all that. The only advice I'd say is any oil that congeals in room temperature, avoid it. Anything that solidifies, like butter, like everybody on Instagram now cooks fries with butter now. Yeah, like lard,
So,
um
but is butter good?
not in excessive amounts. If you
Mm,
can, if you can avoid it, avoid it. So what we advocate, olive oil, um olive oil generally is one of the healthiest,
mm.
but it doesn't taste nice, but that's it.
They don't
I'm
sell
a
it in the big
natural,
jerry can that we used to buy. They only sell it in churches.
Small, and and you can use we advocate for natural fats like avocado. So it is a new terrain, but personally I just try to avoid so much oil in my meal.
Mhm.
Yeah. So we need to check our immunization status. When we, of course, everyone should have the flu jab. It's very, very important. And for people, if for tetanus, if you can get a booster, it should be gotten every 10 years, tetanus booster, so that any bite or scratch will not delete someone. And then there's something called hepatitis A and B vaccine. It's very
Hmm.
important. Hepatitis B is even more deadly than HIV. So hepatitis A and B vaccines very, very important. And
Which one
if
do you say is more serious? Which one? Hepatitis B.
hepatitis B, it can,
How come? And people don't
hepatitis
know
B,
about it.
we well, we keep on advocating, talking to people to
Is there a vaccine for that one? Hepatitis B.
people. Yeah, there's hepatitis A and B vaccine,
What
so you
about
can
B?
get it. Yeah, yeah, you can get it. Yeah,
How do
yeah,
you get that B? Is it
you
through
can.
blood or sharing noodles and I mean body liquids and all that? How do you get it?
Yeah, body liquids. It can be on the table. That's why they always sanitize everywhere. So someone that's got hepatitis can transmit it through the droplet of the body and the blood. So we always advocate that people should have the vaccine, hepatitis A and B vaccine. And you can always request this from the surgery. And after the age of 60, you should get vaccinated against herpes virus, so that you don't have shingles. So all this is inside that list. I've sent the link to Sister B. You can just go through it and now schedule. Am I 60? What do I need? Am I this? What do I need? And most importantly, hepatitis A and B, health workers, anyone working in the health field, ensure that you are up to date with your vaccination.
Especially if you are a care worker, you support worker working with people who use people who are, what do they call this? There's this service users group in the UK. Remind me, Dr. Ade, they call them people who use substance, yeah, substance misuse and
Okay.
drugs and alcohol. Yeah.
Yes, 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 yes. So we always tell the health workers to vaccinate themselves and check their status regularly. Dental check, always check your teeth. Every 6 months, go for regular checkups. Not it's not a red flag, it's just screening to be sure that you don't because it's the only part of your body that can regrow. If it's gone, it's gone. You'll now be but you can preserve it. Yeah, so that's it. Now for the eye, from the age of 12, anybody that has got diabetes, because some people have got diabetes even as children, from the age of 12, anybody that's got diabetes should have an annual eye check. Um, After the age of, you can be checking it every year until you're 60 years old. Then after that, you can reduce it to every 6 months. But the optometrists are everywhere. You can just schedule your time to check your eye, check the eye pressure, check your glasses strength, because there's something called glaucoma. You don't want that happening. Now, I don't want to start
Mhm.
naming all these things, but just check
Mhm.
it, because when the pressure is too high, there's a medication that they can give you to suppress it.
Right.
Yes. Now the that's the E. Now I have the STI. STI. Now, if you know you are at risk, now I don't want to talk about at risk, but you can Google at risk. If you know you're at risk of an STI, maybe via your lifestyle or the lifestyle of your partner, please check for HIV, check for, you can just go to iCash and then they check it for you. And I think it's free. I think it's free, but check yourself, because some people have come down and with something like when did this happen? And they just
They are
ignore.
not even aware that they have it.
Yeah, yeah. So
What
another
about what about intending people when you meet people when you are dating or before you start sleeping together to
okay,
check all those things? I
okay.
think that's part of it too.
So two things. Okay, there's like 3 or 4 things for people that are dating. First of all, the blood group. That shouldn't be come to a surprise to each the intending partners. Secondly, um, any ah, okay, blood group, and well, I thought,
Genotype.
yeah, the blood group and genotype. Of course, the STI screen has to be done. STI screen is not just HIV, so we do um, gonorrhea, chlamydia, and then there's another one. I think
I wonder how many people remember to do this before they start knocking when they meet each other. Not
the
many people.
emotions, and then people don't are not aware, and then they don't know where. So iCash is the place where ICASH is where people go to here in UK.
ICH.
ICASH. ICSH.
ICASH. I didn't even
iCash.
know that.
Yeah, iCash.
iCash.
Yeah.
Hmm.
And it's very discreet, confidential. They just do that, and you're fine. I always tell people to ask for family history of diabetes, raised lipid, any cancer, any breast cancer, because the person you marry, you're going to have children, and this can run within your kids, and they will be, and you can't disown your kids even if you eventually leave. So, but that's for another day for checks before getting married. Yeah. All right. So the ones you can request in the hospital that are for people that are here, working, paying tax. When you are 50, you should be offered a breast screening test. So if you
I've
have,
done mine. I've
yeah,
done mine.
yeah. And when you are 70, you can self-refer. You can actually ask them to do it for you. But before 50, they wouldn't do it for you routinely. Now, there's something, the other one is the cervical cancer screening. Now, from the age of 25 to 64, they call you, I think, every 5 years. And then, no, it's over every 3 years from age of
Yes,
20.
for women. Yeah. Is that the smear test? That's the smear test.
Yeah,
Yes.
and every 5 years above age 50. So don't ignore all these calls. It's very, very important. And if you do it outside, if you do it back home, they're expensive. So these are things that we should take advantage of because it's here for free. Bowel cancer screening. Now, I've said it. If you have a family history of any deletion via bowel cancer, or tell the GP so that they would screen you earlier. Now, anyone, whether you have it or not, anyone age 60 to 74 will be given a home test kit to
Yeah.
screen for
Yeah.
bowel cancer. Now,
Hmm.
if you're 75 and over, you can actually request and ask for the screening test every 2 years. Then the last one is called the abdominal. There's something called abdominal aortic aneurysm. I would explain it. There's a big, large vessel running through the tummy called the abdominal um, artery. Every man that clocks 65 needs to check because we want to detect any abdominal swelling. Now, this swelling can burst if it's not checked and can lead to sudden deletion.
What about all these uncles that have really, really massive tummy?
Okay, so massive tummy, one of the causes alcohol because of the liver. So, and then the abdominal fat, there's something called andropause. So for women, we say menopause. For men, andropause, where all the fat in the body moves down and accumulates around the
The
tummy,
waist.
the
So
waist.
men have andropause.
Yes, they experience andropause, and that's one of it. Of course, we've got the alcohol. If every man can stop alcohol, they would lose a lot of the tummy fat.
Some of them don't drink, but they say it's food that is causing it because I've seen a couple of people that don't drink
Even women,
alcohol.
even women as they get older, they have
Yeah.
abdominal. Yeah, so it's something similar to the men. Now, of course, sedentary lifestyle, but in 9 out of 10 of them drink alcohol.
Hmm.
Yeah, and andropause too. They have some changes, body changes, and that's part of it too.
I see.
Yeah.
So it's not only
So
women that have menopause,
no.
andropause. Because it can't mm-hmm.
Yeah. So
Wow.
is
Thank you so much for so much information. Really, really appreciate you. An hour and a half of loaded information. This is a masterclass. How I want to, I'm going to put your email address now for that information. People who want to purchase it.
do
I
you
have
want
your
me,
email
do
address
you
so
want
that.
Do you want to post the link on the chat?
I have the link here. Okay, should I post it?
Yes. I just sent it by WhatsApp.
You sent it to me
By
just
WhatsApp.
now?
Yes.
Oh, okay. Is it not the one you sent to me before by email? Is it
No, no, no,
different?
no, no. There's a link on your WhatsApp. The seller.
Okay. Okay,
Yes.
let me see. Yeah. So if people want to get in touch with you and they want, okay. Okay, I'm gonna send it to email so that I can open it up here. Right. This is really, really interesting. Thank you so much.
Yeah.
People are asking about getting the list. How do they get the list?
I can let me send the list. I would send the link as a public chat.
No, if they want to purchase it, you said you were offering it for $10.
Yes, so I will send the link there. I will send the link to everyone on the chat.
You're gonna send the link here.
Yes.
Oh, okay. So they can buy it from there, from
Yes.
the.
Yes.
Oh, okay.
Yes.
Excellent. Okay, please do that. Just put it there, and then yeah, people can always go back there. We can put it in the finished. Yeti, thank you so much. Oh, I'm so grateful. Thank you. Naka, I see your handwork. Oh, God bless you. Thank you so much. This is loaded information, my people. Please don't treat this with levity. Health is wealth. You need to take this seriously. I'm begging you. Because at the end of the day, every day we are hearing that people are deleting. What is making people delete?
Hmm.
There is a reason, no. All these things, like before, I want you to say. I mean, before we take a few questions, I want you to say something about how you know um you were saying that in your experience in your GP practice,
Yeah.
you discovered that the what you are saying for Oyibo people and our people is different in terms of the way people are presenting with different kind of things.
Yes. Yes. So, like I mentioned earlier, our the information, the health information, a lot of us we didn't grow up here, so we don't have complete health information. So, that might not even help. Um, oh, okay, thank you. Yeah, that's the link.
That's
Yes.
it. I'm sharing it there, and I'll also share it in the comment section. Now go ahead. They
Yeah.
can still hear you. Mhm.
Okay. So usually before we call patients, we look at their family history, things they've had before, father, mother. Most of us don't have all this information. Even reports back from back home, you can bring it. We'll scan it.
Because
That
it's only witches and wizards that only delete people in Africa. That's why.
no, no. Bring all your notes, all the reports, records. As you are japaing, go to the hospital. Tell the doctors to give you all the family health records. Bring it here as you're registering the children. Hand it over to the receptionist. They will scan it into your page, and that would enable us plan the appropriate support you need. Because that is one thing I feel is not optimal. A lot of people, that's the last thing they consider when they're leaving the country. And when we ask questions, don't feel you are stressing us or you're like, what's all this? Don't minimize it, especially the men, especially the men. And come on time. Come on time. Because I know that the people have different health behaviors. Some people believe in the trado method, in prayer, spiritual. However, God has given a lot of most of the prayers you're praying. The miracle, the answers have come in several forms: advice, support like this, information, books, and even treatment, medication is all part of God's knowledge and gift to man.
Yeah, I posted the link to if you want to purchase the $10, is here in the comment section. Just click on the link there. If you see Obodo Ibo TVs on the screen, it's on the comment section. Just click on it to buy
Yeah,
that. I think any tó bá wà láyé
yeah,
òun ló ń ṣe nǹkan o. Who know they life? How the wahala, what would they do? What are we doing it for?
yeah. So
But the thing, yeah, what I find out is that a lot of people, it's not because they are shy or they don't want to share information or they don't want to share anything. It's because they don't know. We don't know. Because most times we don't even know the cost. In Nigeria, people tend to hide these things. Nobody wants to say this is what is responsible for why their parents deleted or people are deleting. During the do you know that Dr. Ade when during I'll keep sharing it in the comment section, in the link, my people. I'll post it after the video is completed. Please click on it to buy it, right? During the pandemic, it wasn't during the pandemic, it was maybe after the pandemic even. There's a family of this Urishabumi. I don't know if you heard it. She deleted, the brother deleted, the sister deleted. You know, people were saying, and I'm not saying that there are no forces as Christian. We know that the Bible tells us not to be ignorant of the devices of the enemy and all that. I believe in all that, but we tend to overdo it in Africa. So people were saying, there's something they call it in Yoruba land, where this is what is the word? I don't know the word they call it when people are deleting in a family. Akufa. That is akufa. You
Mm,
understand?
mm,
It's
mm.
obvious that there's something going on in the family. So I think in some cases, people don't actually know what is responsible for why their family members are being deleted.
So I can give you some things that can run in families that would warrant screening of the entire family. So there's something called um, emo raised iron levels, hemochromatosis. When the iron levels is really high, if it happens in one person, everybody needs to be screened and treated. There's something called familiar hyper. Now these are words. I'll just name it the way we familiar hypercholesterolemia. That's raised cholesterol in the family. That's where you see even children that are born having raised lipids. It's a gene, it's a genetic thing that needs to be. Everyone, as they're delivering, just let the doctor know once they are 7, they go for the screening. Type 1 diabetes. Not type 2. Type 2 is the one that happens when people are grown above 40. Type 1 happens even in children. Yes, in children. So if someone has got type 1, if you have that aunt that's always been using insulin since she was 7, 8, have the children. And even in the spouse, if it's from the spouse family, it can start in it, you can have kids that will have it. So just go for a routine blood glucose check, a fasting blood glucose check. Another one is uh, there are several that runs
Yeah,
in
that's why
families.
you need to get it. Get it. I've put it there now a couple of times.
Yeah.
If you check the comment section, you'll see the link to purchase the whole system red flags from head to toe, of which is more detailed than even what she gave us because that was just paraphrased because of time. Thank you so much, Dr. Ade. I really, really appreciate you. God bless you. Thank you for sharing with us your wisdom tonight. So I hope people will take advantage of this. If you have any question for her, please let's quickly take it. We've done an hour and a half so that we can call it a night. I know that I'm even impressed that we have up to 872 people. Usually, when you talk about health and well being, people are not interested. Our people
Mm,
are not so interested in this kind of content because it doesn't interest us, but we need to start taking our health seriously. What's the point of working so hard, you know making all this money if you're not going to be here to enjoy it, to see your children's children?
mm,
In my line of work, I see Oyibo people, they are so old. I'm wondering, you are so, now, you are in the UK, so you understand. It's an
yeah.
aging population. People they are so old.
Mm, mm, mm,
They live long. I'm wondering, why is it that they are living so much longer than us? What is the average lifespan in a place like Nigeria? Here is 43 or 45. But here you see aging population, you see people in there. If you are 87, you are just starting 90. I have a woman on my caseload. She's 102.
mm.
102. Wọ́n pọ̀ bẹ́ẹ̀ yẹn. Why? There's a reason.
But you know that one thing I've also realized with them is that when you look at their case notes, a lot of them have survived things. They will tell you, I had this so years, I got it out, I'm moving on with my life, I had this stroke, I recovered. So they bounce back. They check things on time, they approach it on time, and that's what helps with the health quality, with their lifespan quality.
Yeah. Yeah.
Yes,
They are very
yes.
open. People in
They're
our
very
culture, another thing is the
yeah,
stigma. People hide illnesses a lot in our culture.
yeah,
There's a
yes.
stigma around not only mental health but physical health as well. The other
Yeah.
day, Faton Ibo, I don't know if you saw, he was very ill. and
Mm.
he was looking so,
Mm.
emaciated and everything. And
Mm.
apparently he's been ill. Nobody knew. These are the things. I'm not saying that you should share it with the whole public, but you'll be surprised. These things are real. People hide sicknesses. They'll say,
Mm. Mm.
I'm strong. I'm strong. They'll be faking it. I'm strong. But there's something wrong. Information is powerful. And medically, they always tell us in this part of the world that early detection helps in any disease.
Yes, yes. Early detection and treatment, health, seeking help, seeking medical care. But there's a culture of silence amongst us. There are three people you shouldn't lie to. Don't lie to your doctor. Don't lie to your lawyer, and don't lie to yourself. Yeah.
You can lie to your lawyer, please don't lie to your doctor. If you value your
Yeah.
life, don't lie to anybody. As a matter of fact, don't lie
Yeah.
to anybody.
Yeah. But I'm sure with all these red flags, I am I'm optimistic that at least we Obodo family would do better.
I know we
Yeah.
will. I know we
Yes.
will because after lo fẹ́ kú, kò anybody to fẹ́ kú. We all want to live long, and enjoy this planet because we don't know what comes after we close our eyes. So yeah, we know there's heaven, there's hell, but that's for Christians. But we all want to be here to enjoy the fruits of our labor. So I want to thank you so much. I does anybody have any question, or should we just call it a night? Hmm? Yeti is saying less stress, less problem. Thank you for all the super chat and all the people doing cash app. God bless you. Yeti said less stress, less money problems, fast intervention regarding illness, more in the abroad with Oyimbos. Yeah. We can also do the same thing.
Mm.
Hmm? Adana, thank you so much. Say my dad was having very black stools,
Yeah.
and my sibling literally pushed him to come here ASP for a colonoscopy. He had his first one at the age of 65. He has been avoiding it. Wow. Okay, there's a
Yeah.
question here for you, Dr. Ade. For life Esther, say when my husband goes to the toilet, it makes noise like having gas while he's going. I'm concerned. Is this normal?
Well, is this a new thing? I don't know if it's new. Now, if it is not new, for you to mention it, that means it's concerning. Um, there's something called irritable bowel syndrome. There, there's something also called celiac disease. So there are several things that can make one very gaseous like that. Now, if it's affecting him, if he's having abdominal pains, maybe if he's losing weight, if there's anything in addition to this symptom, then we need to explore it. But it could just be that he needs some dietary modification to avoid some food
Yeah.
or use some medication to reduce the production of gas in his tummy.
And if he's not exerting himself as well, that's one thing I find with a lot of our men. We need to develop this habit of, even if he's walking, we are not used to going to gym. The younger generations go to gym, but a lot of the older generation don't. So you find that a lot of our men, all they do is go to work, come home, eat and sleep in front of TV, or they go to sleep. A bit
Yeah.
of exercise is good. It's very, very good. Even for gas. I don't need to be a doctor to know that one. Okay,
Mm.
another question. Ledger Court said, what of severe itching of the bum bum at night? They are talking about,
Into the borehole. Yeah.
yeah,
The first thing that comes to my mind is I don't want to say the worms, but it's a valid concern. You can go to the GP and then they will test you for some worms. I don't want to mention the name, but it's a valid concern. You shouldn't
yeah.
be having anal hole itching, but it's not a red flag. It's not a red flag.
Okay,
Yeah.
okay. Go and get it checked out. Go and get it checked out. I think that's what you mean. Can somebody have an infection in that place? Is it possible?
In fact, there's anal cancer. Yes, there
Oh,
is
okay,
cancer of the
okay,
yes rectal cancer.
okay, okay. Ledger is asking another question. What about when breast is pressed, liquid comes out like sticking and watery, but not discharged? And last baby was 8 years ago.
Okay, so it depends on the age. If it's sticky, watery, we need to see. Yeah, you need to go to the hospital to see. It could be that you need to check. and hormone, maybe the prolactin, check your hormonal levels, and then see and do a mammogram. But if your
Okay.
last baby is 8 years, your prolactin level should have dropped. You shouldn't be having
Yes. That's
nipples.
a long time. Yeah.
Yeah.
Okay. Somebody is saying that they're having problem buying your paper. She said, I just tried buying the ebook, but it would not let me change to a UK address for payment.
Oh, okay. I would have to do it again.
Okay, let me put your email here so that if people are having any problem, they can just contact you. Or
Yeah.
is it in that link?
Yeah, you can
Is,
send my email.
let
Yeah.
me put your email there. Okay, let's take another question. Uh can see questions. What about floaters? Is it floaters? Can it
Okay.
be removed?
So for floaters, it just shows it's like so the eye. How will I explain it? Floaters is not a red flag, but it's a sign that the eye is aging. So is that you're straining your eyes, looking at the computer for too long, or your phone for too long, or the eyes is just dry. Um, People that stay into the computer experience this once in a while. So we usually advise them to use warm compress on their eye. You can buy that from the optometrist, or you use the eye drop. Um, but I would strongly advise to keep checking. Just check every 6 months. But seeing floaters is just can just be a sign of the eye just being strained.
All right.
But it's
So
not a red flag.
if
And
you're having any problem purchasing the material, please email her. Her email address is simple. It's adesola.ajibola.
no, Ajiboye.
Is it Ajiboye? Oh my
Yes,
God. Okay,
Ajiboye.
let me correct that. Sorry
Yes,
about that.
yeah,
And just send an email adesola.ajiboye at
at gmail.com.
gmail.com. Yeah, drop her an email if you're having any problem with purchasing the information. Very, very important. Please let us take our
So
health seriously.
I want to
Somebody's
add
asking a question. Okay,
I
go
want to
ahead.
add something to the eye. Check
Mhm.
your blood glucose and your blood pressure. If they're normal, when I say normal, that is blood pressure that is less than 135/85 at home, or blood glucose that is between 7 to 11 millimoles. It depends on I'm trying not to give values because we use different glucometer checks and they come in different values. But you can just check the normal for the ones you've bought. As long as they're normal, then that means there's no diabetes causing it or no hypertension causing it, and then you're good to go.
All right. Thank you. So if you're having any problem purchasing that paper, that's Dr. Adesola's email. Drop her a line. Yeah. Whether you are in the stream now or you're watching
It's
later.
Ajiboye.
I'm getting it wrong again. Emma Gbami o, kí ló dé? Okay, there's a very, very, very important question here. Maybe I'll get
Okay.
it right. 10
Yeah.
times lucky.
So what about
Somebody is talking about blood in their pool. Something
okay?
you already talked about that is
Yeah.
quite
So
dangerous.
if you've got hemorrhoid can be external. External is when you strain, you see that big pile come out. It's like a lump down below. And hemorrhoids can be internal, inside bleeding. So the difference between the bleeding of hemorrhoid is that the bleeding will be separate from the stool. So the stool will be normal color, normal brownish color, and then you see the blood separate. And usually at times it can come like a splash in the pan. So that's one thing for hemorrhoid. Now, if this blood is mixed with the stool, like either the stool is dark brown, dark black, sorry, black, or really dark brown, the blood is like circling around it, then that is a huge red flag. It needs you need a colonoscopy. You need to see the doctor immediately.
Right.
Yeah.
Okay. I think I
So
finally got the email address right.
yes,
Adesola.ajiboye.
yes, at gmail.com. Yeah.
Okay. All right.
But blood in the stool is not normal.
Yeah, it's not normal, right? Okay. I think that's all we have tonight. Somebody is asking about if you are not seeing far. If you are not seeing far, is that not an optician problem that
Yeah. So
spectacles? Go to
yeah,
Specsavers if
next
you're not seeing far.
Yes.
That one I know is you can if you're not seeing far. I don't think that's something that is one of the
Red
red
flag.
flags.
No, no.
No, it's not. It's just normal. Maybe your eyes are strained and you need
Yeah.
glasses. Go and get glasses. Some people don't like wearing glasses. Even when they are straining, they will not wear glasses. That's a
Yeah.
problem.
Yeah.
Mhm. Okay, this is the last question I'm going to take. Bless said, in general, in birth control, is birth control bad for the body long term? Is it linked to any kind of disease, cancer, or fibroids after you stop using it? Will it affect fertility or cause miscarriages?
Okay. Wow.
That question is like three questions in one.
Yeah. Yeah. So I wouldn't say birth control is bad for the body. Now, like every other hormones or medication, we've got side effects and the effects, which will be discussed with you elaborately before they start you on the ones you choose. So
Mhm.
that's the question too. Is it bad for the body? Some people can't, and sourcing birth control is like looking for the best, maybe foundation or cream. There are different options, so you would eventually find what works for the body long term. Now, secondly, is it linked to any kind of disease, cancer, fibroid after you stop using it? Um, Now, what I can say is that there are some particular birth controls that shouldn't be given in the presence of an existing risk of of a disease. But I don't know. I've not seen a particular, because there are different kinds of birth control. There's the copper T, which contains no hormone, which won't do anything. Just stop the baby from implanting. So it doesn't contain anything. You can be there for 10 years. Nothing will happen. The only thing that can cause is maybe heavy bleeding or painful periods. The ones that that has hormones they have side effects. Each of them, the control pills, the progesterone, the Mirena, but you can always stop and switch to another. So I wouldn't say that a birth control particularly causes disease, cancer, fibroid. No, no, no. Now, will it affect fertility or cause miscarriages? Now, there are some, like the implant, like the injection, that can take some time to reverse. Um, but some people complain that it makes them get them bigger or start having headaches or tenderness. I wouldn't. It doesn't. It actually prevents pregnancy. It doesn't cause infertility.
Somebody's even asking whether it causes, Princess is asking, can it cause cancer? Birth control.
No, no, no,
Hmm.
no. So when you stop
Hmm.
taking it, your body, the hormone wears off, and then your body gets ready to take in a baby again.
These are all the things they say so that you
Yeah.
don't take it, so that you keep having babies that you cannot take care of.
So the ones that people say um, immediate reversal, immediate. Once you take it off, you can have that's
Yeah.
the non-hormonal one, the copper T. But every other
Knowledge
one,
is, sorry, knowledge is, I can't see your question. I've been straining to see it. I can't see it. What did you ask? You say, please, what about my question? Can you ask it again so that I take it very quickly? Because I need to
oh,
let,
she asked about MRI.
is that what she asked? Okay.
Someone asked about MRI. So
Knowledge is, what about my question? I can't see her question. I'm scrolling and scrolling. I can't see it. Okay, go
okay,
ahead.
about MRI. MRI is a very, very strong diagnostic investigation. You'll be passing through a blood tube. It shows the body, the nerves, the muscle. So we use it when we are worried about maybe a nerve damage. It's like after CT, we go to MRI. So it's a very strong one. Um, in any situation of nerve damage, for example, like the cauda equina, that back pain that I told you about, sudden numbness of the leg, not feeling the area you wipe, losing control of your bowels and bladder, it shows that a nerve is being compressed. That is an indication for immediate MRI. Yeah, so they use it for to check nerves around the body.
All right.
Yeah.
Thank you, Temiti. Temiti said it's going to be difficult to talk about contraceptions, choices, merits, and demerits in this discussion. Book an appointment with your nurse. Okay, book an appointment with your nurse. We are here to talk about,
Red
red
flag.
flags,
Yeah.
and she's done justice to it. So please, the information is there. If you want to purchase it and gift it to someone, you can even give it to your parents in Nigeria. Somebody, even if they are not educated, especially the educated ones that can read, so that when they see a symptom, they will know what it means.
Yeah.
All right. So
Yeah.
please, $10 is nothing. No, don't say, why are they selling it to our people? But I know Obodo Farm. I trust you guys. You guys are not like that. You are not our usual people that like Ojo free. You don't like Ojo free too much. Yeah, it's very very important because health is wealth.
Yeah.
I'm really glad because I did mention it in our previous show that we are bringing, that you are coming here to talk to us tonight, and I'm really impressed. Usually, I didn't even know we'll get out to this, but Uluwa Oshun, thank you, thank everybody. I thank everybody for being here. It means that we are taking our well-being and our health very seriously now because people are just dropping right, left, and center. Hey, Joe,
Mm.
let us take it seriously. It's no joke. Health is wealth. Yeah. All right, thank you so much, Dr. Adesola, beautiful, beautiful woman. We are
Thank
bringing her back soon. Oh, if you have a child who has special needs, hmm. I saw what she wrote on her Instagram page. It's like you did a miracle. I
you.
don't know how you did it. You said that your child was non-verbal,
Yeah, she
and
wasn't.
because of all the things that you did, that girl is fully
Yeah,
talking. She's
she's
talking
talking.
now.
She's talking. She's in a mainstream school. She's doing really well. She wasn't talking until the age of 6. That was why I stopped. I stopped what I was doing because I had to be who I was looking for. I had to do all the gaps. I had to fill it. I had to go learn about special needs and help my daughter.
Wow. You need
Yeah,
to share that wisdom with us. And I saw
yeah,
that. I'm like, no, you got to share it because we have a lot of parents on this platform who are going through that process. They are struggling.
yeah,
You know, I have a couple of them that have reached out to me. They are just doing it by themselves.
yeah,
The daddies are not involved. They don't want to have anything to do with them. You know how difficult it is. I
yeah,
don't need to tell you.
yeah,
Having
yeah,
a child in this part of the world is difficult. Having a child with special needs is even added responsibility and a lot of burden.
yeah.
It's not easy. So I need you to please come back when you can, please, to talk to other parents and to help them and share those tips. What helped you, please?
Okay, I will.
Thank you so much.
Yeah, thank you.
Thank you so much. Someone is asking, is it autism that your child had? Does it have to do with autism? What your child had?
My daughter's diagnosis.
Yeah, yeah, yeah. Was he autism? Was she autistic?
Yes. So
Okay.
I don't want to go into autism. So
No.
that
Yeah.
so it was A, ASD and APD.
Hmm.
APD, auditory processing disorder.
See, I'm telling you that we have so many people. See, I need it. I need this desperately. Kumbi saying I have two beautiful souls on this spectrum. You see, we need
Mm.
you to come back. So you said January.
Yes, I will. I will do it very.
January is not too far. So yeah, I
Yes,
know you are very busy. So January is fine. Please make time for me. I'm begging you. I know you got a lot going on, but
I will.
this. I mean, people need help. They need information. Information is power.
Yeah,
Thank you.
yeah. Thank you.
Thank you
Thank
so much. Yeah, I will tell you guys ahead of time. Keep watching. I will tell you ahead of time when Dr. Ade is coming back again to share what she did to get her daughter, who was non-verbal. And that girl is thriving today now in mainstream school in this United Kingdom. Oluwose, well done.
Yeah, thank
Well
you so
done. Thank you so much, my darling. I appreciate you. So
much.
if you're having any problem, I've already shared the link. Let me share it again. To purchase this paper is in the comment section now. I'm sharing it right now. But if you have any problems purchasing it, please contact the good doctor here. Okay, so that's the link to purchase it. It's on the comment section, and I'm going to also add her email address once more so that you can reach out to her. Please don't email her or to give you advice about the non-verbal and special needs. Please don't do that. She will come here. I just told you this to prepare you because I know our people. Because you want her to give you information, it's not something she can give you one to one. It's something I'm appealing to her to use her time, her energy to share with us what she did. So please don't send her an email to advise you on what to do about, if you have a child with special needs. Wait for her to come back. She will definitely come back. I'm begging you. Just wait, she will come back. In January. January, she said. We trust that
Yes,
you're going to come back. Thank you so much
I
for
will.
tonight.
Yeah, and maybe a Christmas hamper tip. You can buy a glucometer, sphygmomanometer, a scale, and what else do we do? You can buy an optometrist voucher and give people rather than buying them
Can
all
you
the.
say it in a language that we will understand? All this mita mita
So,
mita mita.
so
Say
the
it. How we
so
going
the
to the layman like us?
okay, so the blood pressure monitor is called a SPIG. It's the electronic blood pressure monitor. It's yeah.
Blood
So
pressure monitor.
so
Everybody
that
will hear
costs
that one.
like 25 pounds or so.
Okay.
The blood sugar check is about 19 pounds. You can buy it on
Mm-hmm.
Amazon.
Mm-hmm.
A scale is about 10 to 15 pounds. And then you can buy a optician optometrist voucher. You can go to Vision Express, Boots,
What's
and
that?
then optometrist check to check the eye. So if you go to Vision Express, at times people pay 20 pounds to check the eye. So if you
Mm-hmm.
buy the voucher, you can give it to someone to go there to check their eye pressure and the vessels behind the eye. So that can be in the Christmas hamper.
Hamper. Instead of
Yeah.
just buying chocolate and wine.
Okay. Exactly. So we want to stop taking alcohol and we want to stop taking sugar.
Ah, that one will be hard a little bit, but
Yeah.
we'll
Yes.
try.
So
Okay.
every family should have that first aid box, that screening check, and it should be our Sunday tonic.
Thank you very much.
Yeah.
Really, really appreciate you. Thank you for being here. God
Yeah.
bless you. We will see you in January. And hopefully our people will be purchasing that MOT. This is MOT
Yeah.
for body,
For
for
the
red
body.
flags for your body. Yeah.
Yes.
Thank you. Have a good evening, my darling.
Yeah.
Thank you so much.
Yeah.
Bye. Bye, guys.
Yeah.
Thank you. Thank you so much, my darling. Okay. Thank you. Thank you. Guys, did you enjoy tonight's show? This is literally a life-saving show. Masterclass. She's one intelligent woman. Very, very intelligent. When I saw what she wrote about how she got her daughter, who wasn't talking and everything she went through, and the daughter is okay now. I'm like, wow. It takes a lot of courage, it takes intentionality, it takes doing the work. So please, if you are going to email her, don't email her about that. I'm begging you. Don't send her an email to say, please tell me what you did with your daughter. No, she will come here and share with everybody. Buy the what she's come here to share with us, the MOT of your well-being. Buy that one first. Okay? Buy that one first, and then we'll bring her back in January. Give this video a thumbs up. If this video does very well, then we'll bring her back in January to share, because I know there are a lot of people, who are, going through this and they need information. People are asking for an IG handle. She's not giving me permission to share that. So I'm not going to share that. I know her IG handle, but I'm not sharing it. She's not told me to share it. If she gives me permission to share it, I will. Okay? But please, Petro, buy. It's only $10. Buy that first. Like the video and share it. Okay? People are asking, what's her Instagram? What's her Instagram? I don't know whether she hasn't told me to share her Instagram. If she does, I will put it in the comment section later. I will ask her if I can share it. If she say I should, then I'll share it. So yes, disclaimer, Buki Ade, thank you very much. The information we are sharing here today, please, I'm not a professional. I'm not a doctor. This is not a hospital. You are taking the information at your own risk. Don't come and say, it's Obodoyibo TV that I heard this information. That's where it's at your own risk, please. Dr. Ade is a trained, she's a trained doctor, but she's giving this information out to you to help you. This is basically just helping a community. So don't go and start quoting us to say, it's you that told me to do this. It's you. Disclaimer. It is well with us. May God help us. Let us continue to put our health and well-being priority, because life first, well-being first before any other thing. All the things that we are trying to achieve, without good health, without well-being, there's no need. Thank you so much, everybody. Give us a thumbs up. I appreciate you. Subscribe if you've not done so. If you want to give us a super chat and you haven't done so, please feel free to support our work by sending us a super chat. And I shall see you on Thursday. There's a live show on Thursday, so I'll see you on Thursday. I hear that somebody else has been deleted again. A Kenyan woman has been deleted in the US. A couple of people have sent it to me. Tomorrow I will not be able to do it, but I will do it on Thursday. So let's talk about it on Thursday. She's a nurse. Yes, you heard me right. A nurse. We thought this is ended. Ọlọ́run ti bá wa dáwọ́ ibi dúró, but it's not meant to be. So we're going to talk about that on Thursday evening or afternoon. Thank you so much, everybody. Give us a thumbs up, like and subscribe, and I'll see you on Thursday night. But Gist Mask continues, and tomorrow, yes, there's a video. Every day there's a video, please. I feel like it's the live shows that people engage more with, but there's a video every day. Okay, so please try and watch, even if it's not a live stream. I can't do the live stream every day because I still got to have a live. You see what I mean? As much as I enjoy them. So tomorrow I'll drop a video, but there's be a live stream on Thursday. Thank you so much, everybody. Thank you, Dr. Adesola. God bless you. I'll see you soon. Bye, guys. Have a good evening. Bye.